Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexsen healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
And we are joined by a colleague, Mayor Bob Coble. Mayor Coble, thanks for joining us.
Thank you for having me.
You are practicing in the firm's Government Solutions Group. And for those of you who don't know, Mayor Bob was mayor of Columbia, South Carolina for 20 years?
20 years.
20 years. I remember calling you as a reporter. Now you're helping clients navigate the government system, and as we know, we have just had a presidential election, and that changes things going forward. We're going to talk about healthcare regulations, and to start us off, under a President Trump administration, what can we expect regarding Medicare?
You know, I think President Trump has said he's not going to cut Medicare, to the citizens. But Project 2025, which is, a blueprint that may be in use in the new Trump administration, does make some changes to Medicare, expands patients' choice, providers, insurance plans, reduces regulations, and does allow market forces to set prices. I think a couple of examples of where it could really impact hospitals would be the equalization of Medicare payment across the sites of care, which would cut back what hospitals can charge for outpatient care.
For the same service.
For the same service, and more scrutiny of the 340B program. I would say this. I think for medical service providers, hospitals, the next few weeks are going to be very uncertain in terms of who's in and who's not in terms of the positions in healthcare. I don't think healthcare was at the top of the agenda, during the campaign. But I think the key is going to be, will Robert F. Kennedy Jr. have a major role? And I think we all know he is a very strong-willed person and has a lot of different opinions on healthcare. Or will it be, people who served in his first administration? But I think what I would recommend to folks in this time of uncertainty is, one, stay in touch with your national associations, the Hospital Association, and the others, and to make sure you stay in touch with our federal delegation, congressmen and women, senators, and make sure they know what issues are important, what issues would be harmful, and what proposed compromises could be offered by the healthcare industry.
Medicare Advantage, which is the managed care version of Medicare, or basically a simple description of that, has been talked about from a policy level as a potential, by Republicans, as a potential default option for standard traditional Medicare for eligible Americans. What do you think the likelihood of that coming to reality would be, and what would the impact be on providers and patients?
Well, I think generally President Trump has been supportive of Medicare Advantage, and he'll certainly undo a lot of the programs the Biden administration of stricter oversight and tightening the purse strings. I think he will look at the Medicare Advantage as a way of privatizing government and the rate adjustments and stopping regulation of the markets. I do think, though, that making it a default position for Medicare is going to be a stretch. He didn't do it in the first administration, got a lot of pushback. So I don't think this is one of the top 3 or 4 issues, and I can see that not happening.
I agree with that. Yeah, I think that's not likely.
Pharmaceutical drug prices, something that can give people sticker shock, cause aggravation. Huge topic for pharmaceutical companies for sure, but also for providers and patients. In his first term, President Trump issued 4 executive orders aimed at lowering pricing. It was focused on reforming the 340B drug pricing program, and the Biden administration also worked to lower prices. Can you give us an overview of these efforts over the last 8 years and maybe discuss what we might expect to see?
Well, I think in the first Trump administration, he did take a few swings at it. Again, it wasn't a top priority. I think it was, I don't mean he didn't pay attention to it. I just mean that he had other priorities he had. I think in the campaign, he didn't really comment on whether he would rescind CMS's drug negotiation powers, and that's very important. The pharmaceutical industry and some Republicans have certainly opposed that. During his first term, one of those proposals you talked about was instituting the most favored nation model, where whatever we sold, pharmaceuticals sold to foreign countries, they had to offer it to us
at the same price.
Same price, yeah. and that lost traction. He hasn't said whether he would be for a cap on the Medicare, per year cost. And I think sort of seeing how that plays out. I think while he's, criticized some of that, I think that is an important issue to lower drug prices. So he may have more of a market-based approach in some way of doing that. I think he's been pretty clear that...
And he could have bipartisan support for that.
I think that's one where you might find it because everyone wants, everyone in the Congress would support a reasonable plan for lower prices. So I think that will be one where they'll try to find, I think, some bipartisan compromise.
Another bipartisan area would be more PBM, pharmacy benefit companies regulation, which is sort of counter to the Republican norm. But I think Republicans and Democrats have both been in support of more regulation on PBMs, and Trump has spoken about that, having more transparency, an idea who owns them, what they're doing, how much money they're making, that kind of thing.
I think that's going to be an issue, and I think he's going to be more market-based on that, and just in general, I would think.
In President Trump's first term as president, he tried to repeal the Affordable Care Act, or Obamacare as it's known, and failed by one vote, where Senator John McCain famously thumbs down and didn't vote for that repeal. He has not taken the same position in running the second time, and the Speaker has said there could be some significant changes to the Affordable Care Act, but it's very popular, particularly with the country, and has worked much better in recent years than it did in its rollout, which I guess is not to be unexpected. What do you think happens with the ACA? Do you think we see massive wholesale changes to it, or they're just tweaks? Because things like the pre-existing condition concept is very popular amongst all voters, and that might be a little difficult to unwind.
Yeah, I don't think you're going to see a repeal because, like you say, it's sort of baked into the country now, the rights that you have, and pre-existing conditions would be, would shock people if we did away with the insurance company's inability to take that into account with whatever they gave you. But I do think the likely scenario will be not a repeal, but the options for less expensive non-ACA compliant healthcare plans, the ones that don't provide everything, but they do it what they do provide, they do it at a lower cost, maybe more market-based in terms of more choices. I do think, though, the real key of what's going to happen will be determined with those subsidies that run out in 2025, because without them, you're going to have a higher cost of whatever you will do.
The marketplace policies may not be as easy to get into, and certainly not affordable, and that sort of frustrates the policy of the original Affordable Care Act, why it was written, to create more access.
I do think everyone should watch that, because it's going to be hard, I think, for the Republican Senate and likely House and the Republican White House to renew those. I mean, I don't see how, after all the, political commentary on it, that could happen. And without those, you're going to see, the cost expand. And I think it would make sense for them to offer the lower priced, but not include, various rights that you'd have to services. Whether that's how that works or not is yet to be determined.
Right.
Yeah, and 2025 is just
it's right here,
right around the corner.
Absolutely.
President-elect Trump has said that he thinks abortion laws should be left to the states. And now that we have his victory and a Republican Senate, and as you noted, possibly a Republican House, some have been wondering if there might be a nationwide ban. What do you see here regarding laws that we might see or suggestions?
Well, I think President Trump during the campaign, you could tell he was not in favor of a national ban. On the other hand, if you look at the various states, South Carolina and others, there'll be a tremendous amount of pressure on Congress and the president to do the strongest possible ban on abortion that can be done, which would be a national ban. I think that's just going to be a fight that's inevitable. I do think, though, that what will temper that are a lot of the referendums in various states that incorporated abortion rights into their constitution passed, and those that didn't pass, say Florida, it was fairly close. So I think you could see a lot of disagreement. And the other thing may be, well, it is up to the states, and that was his position. So I would think he would likely try to maintain
he might
that.
have some pressure from his party on this to take advantage of the mandate, and if they have both houses to proceed, and we'll find out, if he was committed to leaving it to the states or not.
I also think the abortion medication that's available by mail will be subject of change.
Right. Robert F. Kennedy Jr. Emerged as a fairly influential political figure in this election. He dropped out and supported Trump, which surprised a lot of people, but he has differing views on many things, and he has gotten some support. He has a lot of opinions about health care, some of which are somewhat controversial. He's announced that he wants to take fluoride out of the drinking water, which has been in the drinking water for decades. President Trump said, I think he was going to let considering letting him, quote, go wild in health care. But we don't know what his role would be. But let's assume he has a prominent role. What impact do you think he could have on health care policy under a new Trump administration?
I think whether he has a major role, and that could be certainly a cabinet position, or a health czar of some description, I think if he has that role, that will be the most important decision that is made on health care issues by the new Trump administration. Because historically, in the first term, there was a lot of, working the edges, making changes, market-based, but
transparency, those kinds of things.
Those type of things but it was not a wholesale fundamental change of everything we've known about health care. I think Robert Kennedy Jr., if given his choice, has the ability to propose radical changes that would, have the healthcare industry highly concerned. Fluoride in water, vaccines. It's probably hard to get rid of vaccines that are currently available, but it would not be hard to impact how the advisory committees are appointed to have an impact on future vaccines.
His impact on the Food and Drug Administration could be significant.
It could, and that, I think, would raise that issue up to one of the top issues that the president would be addressing. And I can't help but think, he's got some fairly controversial issues on the table, whether you agree or disagree, immigration, tariffs, and things of that nature. Does he want to put a health care, issue into that bucket, or does he want to just sort of, make changes that, are more market-based and put his attention on the issues he ran on more so? The other thing I think with President Trump, I think we've seen this, is I don't think he likes when folks say the Trump administration is going to do X and the Trump administration is going to do Y and I'm going to do X and I'm doing. I think he likes to, as most good politicians are, sort of keep the decision making with himself. So I've noticed that Robert Kennedy Jr. is making a lot of pronouncements on various things, and it'll be interesting to see. I think that's going to be resolved, Thanksgiving before Christmas, and that will determine whether it's the level of change that you will have in the healthcare at the federal level, and that's my view.
Yeah, one thing to watch if you have Kennedy in a significant policy role in healthcare, if there is another pandemic or public health emergency, which a lot of people think, just based on different factors, could happen again, things will be handled much differently than they were. And there are a lot of criticism about the way the COVID pandemic was handled. But I think that would be an interesting scenario if we were faced with that, with him in some policy-making role. So,
well, let's hope the variants don't come out for another 50 or so years.
Let's hope.
Finally, we've asked you to cover a lot of topics, but what should our hospital and provider clients be watching for? What should they be monitoring in these next few months?
I think the first thing is Robert F. Kennedy Jr. appointed to a high-profile, meaningful position. And if he is, there are going to be a host of issues that they're going to need to address, deal with from start to finish. Fluoride in the water would probably be one that the Dental Association and others, city municipal systems, a lot of issues like that. The second would be, are there going to be major, a repeal or major changes to the Affordable Care Act? Or will it be, a more nuanced, market-driven, more choices, that type of thing? And I think thirdly will be, is there going to be a national abortion ban effort? I think those are three issues that are not hospital specific necessarily, except for the Affordable Care Act, but will change the landscape of the discussion about health care. If those aren't on the table, then I think it's more of a, how do you make market-based changes to the healthcare system and probably operate in the Congress and committees, the way that things have normally been done.
As we end on a positive note, I will say that under a Trump administration, it is possible that we get additional regulatory rollback in the healthcare space, which could be welcome. Laws like the Stark Law, maybe the False Claims Act, some of those have been subject to criticism by the Republican administrations, and that could be a welcome regulatory rollback if it happens.
A loosening up of the antitrust.
Right.
I think that's, maybe a philosophical difference that the Trump administration would have, that I think the business and industry, insurance,
that'll be received as pro-business. Yeah, right.
Viewed as very pro-business.
Well, you've got your work cut out for you, Mayor Bob.
Well, we do a lot of state work, and so I'm sure all of that'll trickle down a little bit, but politics is always interesting.
It is. That is for sure. You guys have worked together in the healthcare space a long time, so I suspect we will have Mayor Bob back as we see how this unfolds. Thanks for joining us.
Thank you.
For those of you who listened today, we hope you learned a little bit more about what you might see in the months ahead. And on behalf of the entire crew here at Taking the Pulse, thanks for joining us. We'll see you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.